substance use. Abuse and dependence as people suffering from diabetes. But again, I keep reminding you, there's a whole bunch more people, there's 68 million who are drinking and using too much. Okay, here's where it's a problem for you to be in the back of the room, because at the very top of this pyramid is a tiny little orange pinnacle. That signifies the number of people who are actually getting any kind of addiction treatment. And it's about 2.3 million to 2.5 million. That is 1/10 of the people who meet the diagnosis. And that, by the way, is the lowest treatment penetration rate of any illness in the world. And it's not right. We need more addiction treatment. Okay? All right. So that's right. But do you have people standing in line pleading to get into addiction treatment? No. Sometimes, but not always. And not only do we need more addiction treatment, we need better addiction treatment. And we need policies and services that are going to get a whole hell of a lot more of the people that are in that pyramid. Addiction is the only area in medicine left that is truly segregated from the rest of medicine. There is no meaningful participation of primary care or general care in medicine, that has to do with addiction. Imagine if you had diabetes, or more importantly, if you had beginnings of diabetes. You had gained a little weight, you had your diet had changed, you had started to express problems that were going to lead to diabetes, but you couldn't do anything about it. You had to wait till you had full-blown diabetes to get care. That would be expensive, and it would produce very, very serious problems. Okay, that's the situation in addiction, and that's one of the things we want to address as we go forward. So, I'm going to refer to this diagram over and over and over as we go forward. Now, if you've had enough already, you've gotten the essence of it, okay? All right. So now I want to talk about 5 of the 7 priorities that we are spending your money, your taxpayers, as we approach Congress with the President's budget for 2011. Okay? It's going to be confusing for you. We're still spending some 2009 money. We're in the middle of 2010. The 2011 budget starts in October of 2010, and we're already looking at 2012's budget planning process. So these are the priorities on what we call the demand reduction side. And it's not going to be a stranger to anybody in this room. And then we're going to go right through every one of them. It's called prevention, intervention, treatment, recovery, special services for those who have criminal justice problems associated with substance use, and better measurement strategies. Okay? That's what you're going to hear. All right. Where do we gin these up? Just, I've made them up, I suppose. Gil Kerlikowske, who's the director of our office, has more air miles now than most pilots. He went around to every city in the country talking with people just like you, talking with police chiefs, talking with judges, talking with doctors, people in recovery to come up with. Meanwhile, we work with what is called an interagency working group. 35 federal agencies, over 100 employees of federal agencies to try to get them to work together. And we put the two together, and we came up with sets of problems that we felt were very important. But they're not just problems. They're, of course, big problems. Prevention, intervention, treatment, recovery are big issues. We picked those things where we thought with science and common sense and finance was possible to get something done. So we didn't just pick big old things like poverty. We picked things where we thought the science says if we apply it the right way, we can see a meaningful difference, okay? We have a very big push towards delivering interventions in community settings. First, the science tells us that that's the best way to organize services. That's where people live, it's where they work, it's where they raise their kids. That's who they care about, people in their community. I'm from Philadelphia. I live in a section called Bella Vista section of Philadelphia. Candidly, we couldn't give a hoot about the people in North Philadelphia or West Philadelphia. But we will care about the people in our section, okay? So we need to build interventions around them. Second, it's the nature of substance use. This country has only two, for the moment, two national drug problems. You know what they are? I thought you were taking courses in addiction. You guys don't even know what the national drug problems are? Come on. Yes, you do. Cigarettes and alcohol. The legal ones, right? Third is emergent prescription opiate abuse. I'll talk more about that. But those are the national problems. The rest of the problems are regional. You don't see methamphetamine everywhere. You don't see even OxyContin use everywhere. And so we need strategies that fit where they exist. So community is a big focus. And finally, we've taken the position we don't need no more stinking programs. Programs happen when the federal government issues a call that there's money. There's money for X. And people who don't even know each other gather around, gin up some proposal, get it together, get some money for X. The program stays together as long as the money's there. As soon as the money's gone, so do the people. It all goes away. Repeat. We didn't want that. We want, in communities, infrastructure that will last and will sustain, because the substance use problems are going to last and going to sustain. I am sorry to tell you that the federal government has not discovered a cure for any of the addictions. We don't have cures, but we can manage them, okay? So let's talk about that. We're going right down the priority list and back to that pyramid. We're starting at the bottom of the pyramid and we're going up, okay? So, prevention. It's time to do something about prevention. It's been neglected for a very long time, but you have paid for a lot of the science that's already been, excuse me, a lot of the science in prevention over the last 15 years has really given us some very important insights into how you would purchase prevention, okay? The first thing is that it's now clear that addiction has an at-risk period. Almost every illness does. Well, you know what the at-risk period for addiction is? Adolescence. People who make it through adolescence without substance use problems, cigarettes, opiates, alcohol, cocaine, methamphetamine, you can make it through your adolescence without picking up an addiction, you're very unlikely to ever get it. And now I know you're going, that guy's crazy. I got a whole program full of people that are 40 years old. I know. You ask them when they got their problem, because sometime, and people argue about the onset, and I'm not going to argue about it, it could have been as early as 5. People get their problems early, and they stay, and then they don't get treatment for a very long time. All right. Yeah, what's the, okay, so what, Tom? So addiction's got an at-risk period, it's adolescence. Well, think about the prevention services you receive. You may have gotten them at some point during adolescence. You know, 8th grade, drugs are bad, kids wear that, okay, good. Okay. That's not the problem. If the period is all of adolescence, then you need preventive services throughout the at-risk period. All right. Here's another thing that science has shown us. That the things that harm our kids, substance abuse, depression, bullying, teenage pregnancy, dropping out of school, delinquency, all of those things have common antecedents.